And welcome back, everyone, to our 1-hour town hall. We're focusing in on New Hampshire's homeless problem. And while it is an ongoing problem, we've got some good news. There is some success.
There is. Right here in New Hampshire, Greater Nashua received the distinction of effectively ending veteran homelessness in 2017.
And there's a program in Pennsylvania credited with ending chronic homelessness. Let's go to WMUR's Charisse LeClaire. She shares their success stories.
For me personally, it's heartbreaking.
For many veterans, coming home doesn't have their traditional meaning.
By the time a veteran comes to me or I find them, they've already been negated 101 different ways by other agencies or other sources.
Oswaldo Pereira is a case manager for Nashua and Hillsborough County with Supportive Services for Veteran Families, a program with Harbor Homes in Nashua. Half of their team is veterans, including Oswaldo. He's one of multiple case managers across the state. Whenever a veteran or service provider calls a national 211 number, team members like Mandy, Kevin, and Oswaldo are quickly at the veteran's side, determining their very specific needs, from counseling to job help to substance abuse treatment, and then set up a plan with a network of landlords to find permanent housing. Their strategies earning them the government designation of effectively ending veteran homelessness.
Does not mean that a veteran will not experience homelessness. What it means is that we have a robust response as a community, that when a veteran is identified as having that experience, we can get to them quickly.
Just 67 other communities across the country have earned the same. While Greater Nashua works to end chronic homelessness as well, 3 communities in the nation have done that, including 400 miles away in Lancaster, Pennsylvania.
The first thing that we had to think about was who is currently experiencing homelessness, who's the most vulnerable.
Jennifer Koppel is the executive director of the Lancaster County Coalition to End Homelessness. It's a group made up of over 160 partners from providers, government officials, private citizens, and more. They're credited with ending chronic homelessness, which are people living 365 days a year outside or in an emergency shelter with a disability. Like Harbor Homes in Nashua, they are data-driven to identify who exactly needs their services and tailor-make plans to that individual.
What's their story? Who's providing services? How can we provide better services? Really understanding the stories of each of those individuals.
Back in Nashua, the wide network of support is always thinking bigger. In July, a new housing facility, Boulder Point, will open in Plymouth, welcoming in veterans and their families. For Project Community, I'm Charisse LeClaire, WMUR News 9.
And so on that note, let's go back to Martha Stone. We heard you say earlier you think New Hampshire can end homelessness. What do we need to do, though, to build on Nashua's success?
Hi, Tom. Thank you. Yeah, I think that one of the important things to remember is that while emergency shelters play a critical role in addressing the needs of homeless, the actual solution to homelessness is homes, as I said earlier. And when we look at the scope of the problem in New Hampshire and we quantify it, if we compare that nationally to some communities, it's achievable. And I think that the numbers in New Hampshire, if there was the political will and the resources devoted to it, we could effectively end homelessness in New Hampshire. Not easily, not overnight. But those are the people in this audience and the people on your panel, we know how to do the work. When people are sheltered, they have a magnitude of needs beyond actually finding a place to live. I think as Maureen mentioned in the introduction, people need a lot of wraparound services, and that's part of what we do is connect them to those: mental health, medical care, dental care, employment, and on and on. But at the end of the day, what they need is a place to live, and there are not enough affordable places. So the question I'd like to throw back to the panel for discussion is, in all of our communities around New Hampshire, what do you think makes the biggest impact for people listening to affect the addition of affordable housing units in all of our communities? I know that, as I mentioned, there needs to be the political will. It may be how people cast their votes. It might be zoning in various communities. But I know that where I live, when new housing developments are proposed, they don't always go through. And so if we want to solve homelessness, we need more affordable housing.
Panel, thoughts, anyone?
I think that all of the things that Martha just mentioned are exactly right. And we also need to remember that by providing permanent supportive housing, it's actually a more cost-effective solution for our communities than leaving people on the streets, because what happens is that when they're on the streets, they're using a lot of public services, expensive public services, and what research has shown is that if we instead provide housing for these folks, it's actually more cost effective for the community. And we all know that having a prosperous, thriving community, absolutely, it's essential that we have housing for every member of our community.
And Mayor Craig, one point for you in the city to deal with homelessness is to develop a task force aimed specifically at that. But what do you do when you talk about the practicality of affordable housing and availability?
Yeah, I mean, that task force has done great work, and it included nonprofits who you have here this evening, as well as community members such as the Chamber and residents and business owners. And we did come forward and will be coming forward with recommendations on how to address these challenges. But certainly, funding is an issue, especially when we talk about affordable housing, and a lack of federal funding is an issue. And so, that's something that we can't not discuss. And I think the other thing as well is to talk about, how do we prevent this going forward? So we know that individuals who are homeless right now, we need to get them into supportive housing, get them the services that we need. And I'm so grateful for the nonprofits like Families in Transition, New Horizons, and Waypoint and The Way Home, who are doing that right here in Manchester and others throughout the state. But we need to look at the health of our communities and how do we prevent this going forward. I think that's a critical part to this.
All right, Matt from Tyler Blaine House, where are you? Do you have one?
Yeah.
Could
I follow up with, from Mayor Craig? Yeah. I'm going to echo what Martha said about this being an issue in New Hampshire that can be solved. A group of us went out to San Francisco, and if you want to see where we're headed, just go there, come back, and you know that it can be done. We feel pretty blessed in Manchester to have a mayor that's willing to listen, a board of mayor and aldermen that are willing to fund things, and the willingness of the Chamber and in town to work collaboratively together. I feel like the wind is at our back, and we started talking with the mayor months ago about what needed to change at New Horizons, and here we are on the precipice of changing so many things just within one organization that has this huge ripple effect on the community. We're talking about panhandling as panhandling. We're talking about homelessness as homelessness, and we're culling all these resources together so that when people come in, when panhandling stops, there's a welcoming and caring place for them to come to, like a triage center. Absolutely, it's about housing, but it's also about all those little steps in between, and having a community that is willing to listen to that, enact it. I feel like anything is possible, quite honestly. We've never had this momentum before.
All right, let me run over to Matt here from Tyler Blaine. Where's Matt? And
you're from Lancaster, Matt?
Yes, I am.
Okay, tell us a little bit about what your organization does.
Well, I'm the manager of the homeless shelter. Tyler Blaine House in Lancaster. We have 8 beds.
You have 8 beds, and the numbers are, you have way too many people for beds, I imagine.
Yes, absolutely. Unfortunately, I'm constantly calling other shelters, trying to find places for people that are calling us, showing up at our place, whatever it is that we can do.
Tell me a little bit about the difference between homelessness in the North Country versus homelessness here in the southern part of the state. People would guess that there's no homelessness up north.
Oh, that's absolutely not true at all. We have, an exorbitant amount of homeless people that, there's camps everywhere in the woods and in the mountains of just people living there, even in the temperatures that we have during the winter where they drop down to, -30 at nighttime, and they're still out there in cars, they're out there in tents. And what I've noticed working with this population is one of the biggest problems is a lot of this population, like was said before, have co-occurring illnesses, and they qualify for disability. Problem is you have to reapply for those disability benefits every so often, and a lot of the people with the disabilities don't understand how to do that. And another big problem that's hurting them is transportation in the North Country.
Right.
We don't have the funding for it right now, and so it's very difficult to get those wraparound services, even though us who work in the shelters know where those services are. To actually get our guests to these services is a huge problem for us.
Where are our counselors from the Dover and Rochester area with us? Okay, could you stand up and give us a sense of what you're seeing in that part of the state?
And your name is what group?
Marcia Gassis, and I'm a member of the Dover City Council and the Tri-City Mayor's Task Force to End Homelessness.
Okay.
So describe a sense of what you're seeing right now.
Well, what we did as a task force is back in the end of 2017, when we had some severe cold and followed by a blizzard, we had to open an emergency shelter kind of unplanned because we were afraid there were people going to freeze to death on the street. And as a result of that, the three mayors, the mayors from Dover, Rochester, and Somersworth, formed this committee, which is made up of representatives from each of the three cities, to come up with a master plan to how we could address homelessness and identify the issues and a solution or a path that's community, all three communities working together.
How critical is it that the community jumps in and binds these ideas together?
I think especially to have effective use of all the resources, it's important that all of the organizations communicate and work together. What I've learned through this whole experience is there are a lot of resources out there, and I feel that in particular now that there's a lot of communication, that there's a lot of meeting of all these groups to try and best address the needs of this population. Like the folks alluded to, there are those that are particularly very difficult to assist, that have special needs, especially with the substance abuse disorders and the mental health disorders, and the lack of what I would call support housing, that we have folks that go into rehab, but then when they're let out of rehab, they have absolutely no place to go, and it just spirals and it keeps cycling. That we need in this state in particular more of that supportive housing, for, especially for folks with substance abuse and mental illness, because many of these people have a lot of those issues and they have no place to stay on a permanent basis.
Thank you so very much.
There's a lot of passion and concern in this room tonight.
It's unbelievable. We've already gone through a half hour. We've got another half hour ahead. We've got a lot more people to get in here. We want to thank this group of panelists. We've got more panelists coming up, and we want to thank everyone. Still to come tonight, we want to tell you a little bit about, in just a 3-year period, that the number of homeless youth in New Hampshire has increased by more than 20%.
Young people work really hard to remain invisible.
Coming up next tonight, we focus on our young people and how one organization is providing a safe environment for kids who don't have a place to call home.
And you can help now by going to our Project Community section of our website at WMUR.com. We have a link where you can donate directly to Families in Transition New Horizons. That organization provides assistance, including shelter, affordable housing, food, and services to the homeless.